Hi everyone, today I'm going to talk about episiotomy. And in this class, we are going to understand definition, purpose, indications, advantages, types of episiotomy, perineal repair, perineal care, and also complications. So let's understand the definition. It's a surgical planned incision on the perineum and the posterior vaginal wall during the second stage of labor is called episiotomy. Episiotomy is a planned tiny helping cut during the second stage of childbirth. When the baby is almost there, midwife might make a small surgical incision at the opening of the birth canal to create just a little more room for the baby to pass through safely. So it's a surgical planned incision on the perineum. So let us understand the purpose to enlarge the vaginal introitus, that means vaginal opening, and to facilitate easy and safe delivery, to minimize rupture of the perineal muscle and fascia, and also to reduce stress on the fetal head. So why can't we just let the nature take its course? Sometimes the nature needs a little assistance. We do this for three main reasons here. To open the vaginal introitus to little more opening has to be done so that the baby's head will come out. So to make the opening a bit wider, like opening a door all the way, it's actually safer to have a clean straight surgical cut that is easy to stitch up than to risk skin tearing naturally in an irregular way. So once the baby is pushing downwards, there are chances of tears. So and also it is safety for the baby. If the baby is very large, if it is in a difficult position like breech, need to come out quickly because they are getting tired. The small cut speeds things up and reduces the pressures on the baby's head. Let's see the indications. So, mostly in every vaginal delivery, there will be episiotomy, that opening of the, vaginal introitus. So, main in the rigid perineum and anticipating the perineal tear to stop the perineal tears. And if there is a large baby, big baby, and when there is a phase 2 fibus delivery, and also in the breech delivery, sometimes in shoulder dystocia. So these are the indications for the episiotomy. Let's see the advantages for the mother as well as the baby fetus. So for the mother, it is easy to repair after the episiotomy done, sutures will be made, and reduction in the duration of labor. Once we are opening a vagina, so it's the duration of the baby to come out. So it may reduce, and reduction of trauma. So by performing a episiotomy, we can prevent the tear traumas on the perineum. Fetal. So minimizes the intracranial injuries, especially in the premature baby. And also if there is a large head, or as I said in the previous slide, due to the shoulder presentation or breech presentation, in those time it minimizes the intracranial pressure on the fetus. So procedure I'm going to explain in the next slide. So before itself, when we need to perform this episiotomy. So the timing of episiotomy is very much important. Timing is everything. We don't do this too early. We wait until the very last moment when the baby's head is crowning, where you can see the perineum is bulging. So this is called as crowning. So visible, like when we see the baby's head through vagina. So this is called as a crowning. This we have seen in the labor mechanism. So here we can see that the skin is stretched thin. It ensures we only do it if it is absolutely necessary. If the baby's head is coming out, then there is a need not to perform this episiotomy. So most of the cases we have to perform episiotomy. So this is the bulging thinned perineum during the contraction just prior to the crowning. So as you can see here, this is crowning, and where we have to perform the episiotomy we'll see in the next slide. Here there are three types of episiotomy we can see: median, lateral and mediolateral J shape. Sometimes it is median and also can be done lateral, sometimes mediolaterals, and you can see J shape. Here you can see a J shaped suture cut will be made on the perineum. So this is J shaped, and this is the lateral, and this is median straight cut. Okay, so here we can see a midline incision and mediolateral incision. So incision is a straight cut. Midline incision is a straight cut downwards. It heals very easily because it follows the body's natural lines, but it's used carefully so it does not go too far. Next is the side line, mediolateral, which is called as side angle. So this is a cut made at 45 degrees angle to the side. It's like taking a detour to avoid important areas. This is often the preferred choice because it provides plenty of room while keeping the path safe. So this is mediolateral incision. So we have seen the mediolateral and median. So let's summarize again. It begins at the midpoint of the forecheck, directed at a 45-degree angles to the midline towards a point midway between the ischial tuberosity and the anus. So midline incision that follows the natural line of insertions of the perineal muscles. Let's see the equipment which are needed for the episiotomy: a sterile drape, sterile gown and gloves, gauze swab and tampon, needle holder, sponge holder, scissors, 10 ml syringe, toothed forceps, suture material, and 1% lignocaine. So let's see the preliminaries. The perineum is thoroughly swabbed with antiseptic solution and draped properly. Incision line infiltrated with 10 ml of 1% lignocaine solution. So here you can see the how to make episiotomy. Two fingers are placed in the vagina, inside the vagina, between the presenting part and posterior vaginal wall. Then we need to go for the incision. Once incision is made, the incision is made by straight or curved blunt pointed sharp scissors. The open blades are positioned. Incision should be made at the height of an contraction. Cut should be made starting from the center of the forecheck, extending lateral either to the left or right. So, as you can see, it is directed diagonally in a straight line which runs about 2.5 centimeter away from the anus. So, when you are making the incision here, so you have to keep in mind that it should be away from the anus, at least 2.5 centimeter away, so that it prevent the injury to the rectum or anus. So after the incision is made, episiotomy is made. Remember, after the placental removal, then we have to go for the perineal repair. Repair is done soon after the expulsion of the placenta. Once the placenta is out, after the delivery of the baby and after removal of placenta, then we have to go for the suturing. Let's see why we need to repair the uh, episiotomy area where we have made an episiotomy. So first, to control the bleeding, we need to give suturing and to prevent the infection and to assist wound healing by primary intention. So these are the purposes. very rarely we can see the complications. So in a unhygienic conditions, if the mother is not following personal hygiene properly, there might be a complications, infections. There might be a chance of vulval hematoma, infection, and rectovaginal fistulas in some cases, and wound dehiscence can happen. If we see in the remote, so these are the immediate complication. If we see in the remote, dyspareunia, which is uh, painful sexual intercourse after the episiotomy, and scar endometriosis. So these are the complication we can see in the episiotomy. Hope you have all understood the class. If you have any queries, please comment down. Thank you.